Where do you see yourself in 10 years? This question can get asked for several reasons. Sometimes simply to know you are a little better and stimulate further questions, to assess your ambitions and aspirations, or to assess your understanding of the NHS organizational structure and career development. You don't need to know what you want to pursue, but you may have an idea about potential options. If you do have any ideas, then don't be afraid to say, provided you have done some research and know a bit more about career progression.
In 10 years, I hope to have moved to Australia and taken up head of colorectal surgery in Sydney. I would have set up state-of-art research unit and developed innovative laser polypectomy and use of stem cells in skin grafting, hopefully. I would be able to afford a yacht. I would have set up state-of-art research unit and developed innovative laser polypectomy and use of stem cells in skin grafting. Hopefully, I would be able to afford a yacht. By this time, I will have found a husband and will have settled down with 3 children. Finally, having established myself at the top of my field, I will begin looking at political office.
This is obviously an exaggerated response, but there are a few key take-home messages here. Never say in an interview that you're planning to move abroad and leave the NHS, even if that's your intention. The NHS provides significant funding for your medical course and they see this as an investment. They need you to stay with them in the future. By committing to the trust, you are making a commitment to the NHS, even if this is not something you intend to do and want to go back. The second big mistake with this answer is that everything is too definite. You have no idea what you will be doing in a few years' time, leave alone 5, 10 or 20 years. While such a detailed answer can show that you are ambitious, it also shows lack of realism. Finally, never mention money in a medical interview. If this is the primary reason, you have chosen wrong career. Think again.
In 10 years' time, I hope to have established myself as a pioneer neurosurgeon. I'm passionate about this area and would have lots of experience in it. Although I'm very open to having my mind change as the situation changes. I would hope to have become a fellow for Royal College and participating in question writing groups. I would also be keen to take other roles, for example, by taking up an RCP tutor post at the Trust or being with Director of Education. If I do focus my career, and I would have a research unit to explore the role of stem cells in treatment of Parkinsonism. I would like to progress in becoming a professor in the university.
This response demonstrates your knowledge about the career options available to a consultant beyond patient care. They can choose and develop as a researcher or academician or pursue managerial roles. The comments about broad-based training also shows dedication and ambition as you are clued up and seriously considering the shape of your future career. The candidate doesn't talk about personal progress, family, hobbies, etc., and that's okay. If challenged, admit that plans can change. Though you are very committed and would like to stick to the plan, for reasons beyond control, plans will change and you have the flexibility and maturity to handle it. This type of questions give you the opportunity to demonstrate your understanding of the life you're committing to. Be open, be flexible for things like research, academic work, starting a family, etc., showing that you have a realistic grasp of the future and the demands of a career as a consultant. It may seem daunting, but it's not that difficult to predict where you might be as the path after taking up consultancy is very well defined. You may not be able to see yourself as a researcher or professor or president of the Royal College, so it's fine to admit that you do not know exactly what direction your career may take. However, mention that you are very keen to develop your research or a role in education. It shows your maturity to appreciate that what interests you and the priorities you are looking for in your job, but they may change somewhat along the line. You can use a question like this to demonstrate your knowledge of how the NHS works.